What is schizoid personality disorder? Do you know someone who seems distant, detached, and prefers to be alone? Not just occasionally, but almost all the time? This is but one sign of schizoid personality disorder, or SPD, a condition affecting an estimated 1% to 4.9% of the US population. Hello, and welcome to the BetterHelp YouTube channel. My name is Sreela Roy-Greene, PhD, LMHC, and licensed therapist with BetterHelp. And in today's video, we're exploring what schizoid personality disorder really is, how it affects people, and why empathy, not judgment, is the key to understanding it. Let's get started. Schizoid personality disorder versus schizophrenia. What's the difference? SPD is one of the lesser known and often misunderstood personality disorders. When people hear the term schizoid, they typically assume it's a type of schizophrenia complete with symptoms like hallucinations and delusions. However, SPD isn't categorized under the umbrella of schizophrenia spectrum disorders, and hallucinations aren't on its symptom list. So, if schizoid personality disorder isn't considered a type of schizophrenia, what is it? In short, it's a type of personality disorder. The Diagnostic and Statistical Manual of Mental Disorders, the standard reference published by the American Psychiatric Association, outlines 10 different personality disorders. They're categorized into 3 clusters, A, B, and C. SPD is classified in the A cluster, along with paranoid and schizotypal personality disorder. The primary symptoms in cluster A-type disorders present as thoughts and behaviors that might be considered odd or eccentric. What are the symptoms of SPD? For people with SPD, that oddness typically shows up in young adulthood in a few ways, including detachment from social relationships, limited social expression, preference for a solitary lifestyle, indifference to praise or criticism, and limited or no enjoyment of activities. While they are often detached from the external world, individuals with SPD may have a vivid and elaborate inner world. Please note, because a person with SPD might prefer daydreaming to socializing, this doesn't mean they're experiencing a break with reality, and it isn't indicative of psychosis. SPD myths and misunderstanding. Given the nature of its symptoms, some assume that people with SPD can't experience love and don't desire connection at all. This is one of the many myths surrounding schizoid personality disorder. While they may appear aloof and happier without any emotional attachment, some people with SPD actually do experience loneliness and a desire for connection. The potential causes of SPD often create a fear of trust and intimacy that prevents them from seeking out meaningful relationships. More on that in a moment. Some other myths surrounding SPD include: people with SPD are dangerous. There is no link between aggressive or violent behavior and SPD. People with SPD can't function in everyday life. Plenty of people with SPD hold down jobs, manage finances, and care for themselves just fine. There is no treatment for SPD. SPD is a chronic condition, meaning it can last a lifetime. However, many treatments are available that help people manage their symptoms and improve their quality of life. What causes SPD? SPD is a complex condition, and the exact causes aren't fully understood yet. Scientists believe it's likely a combination of genetics and environment. Research shows that people with a family history of schizophrenia or other personality disorders are at a higher risk. Upbringing might have something to do with it too. People who grow up with abuse or neglect, or who lack nurturing, loving relationships in childhood appear to be at higher risk. In some cases, abnormalities in specific brain regions involved in social processing and emotion regulation may play a role. Premature birth and low birth weight have also been linked with SPD. SPD treatment options. Psychotherapy is the first line of treatment for SPD. A strong therapeutic relationship, the rapport built between a therapist and patient, is key for favorable treatment outcomes. Treatment plans are usually structured according to the individual's specific needs. They might include a combination of cognitive behavioral therapy, CBT, group therapy, and family therapy. Medications aren't typically used to treat symptoms, but they might be prescribed to manage co-occurring conditions common to SPD, like anxiety or depression. How to support someone with SPD. If someone you know has schizoid personality disorder, the best way to support them is to treat them with respect and educate yourself about the disorder. Don't push for closeness. Don't take their preference for distance personally. Instead, accept their boundaries and let them set the pace of interaction. Give them space, but let them know you're around if they need you. When to see a mental health professional. People with SPD may not need to see a therapist unless the person is in crisis or has a co-occurring condition. But when symptoms cause significant distress or impact your ability to function in daily life, it might be time to seek professional help. Also, consider speaking with someone if those who care about you have expressed concern. Symptoms of SPD may not be necessarily problematic on their own. However, symptoms like social isolation and emotional detachment can contribute to co-occurring conditions that typically require intervention, like anxiety and depression. What you can expect from therapy. The goal of therapy isn't to force someone to be more outgoing. It's to support their autonomy and well-being. If you decided to explore a diagnosis, therapy will involve examining your symptoms, how they affect your life, and their potential roots. During the course of treatment, a therapist might help you develop strategies to manage your symptoms and improve your ability to connect with others, help you learn and practice social skills such as communication, empathy, and emotional expression if you desire to build closer relationships, and help uncover and address any co-occurring conditions such as depression or anxiety that may be present. Remember, people with schizoid personality don't always need or want to change. Many are perfectly fine with limiting their interactions with others and keeping to themselves. So, if you know someone with SPD, don't take it personally if they decline social invitations or limit conversation. If you have SPD and the condition is interfering with your well-being, considering reaching out to a mental health professional. SPD can be challenging to navigate, but you don't have to do it alone. Thank you so much for watching. If you found this video helpful, give it a thumbs up, subscribe, and enable notifications to keep up with the latest content. The BetterHelp channel is full of informative, helpful resources on mental health and wellness. Take good care.